as the nation's doctor component. And although not budgeted to go out there and say, we will fund this and we will fund that, what I've learned in these last few years, serving for 3 years as the Deputy Surgeon General and now the last year as the Acting Surgeon General, is that this position, the position of Surgeon General, still has an impact in this country. This past week, we led a call to action on skin cancer prevention, right? I get really nervous, T-minus 24 hours before we release something, because it's like you're throwing a party, and what if nobody wants to show up? And a lot of times we sit back and say, oh my God, is anyone out there interested? And yet what we find is, to some extent, the message is important, but what the world likes, and the world as controlled by the press plays a key point in this, is they hear from the Surgeon General and they say this got to be important. So again, your Surgeon General now is saying breastfeeding is important. It will remain important. So I thank you as I decide how I'm going to move on to the next slide. Have I said how much I love you already? So where are we at on all this? Certainly we know, and I go back to my predecessor. So let's give a round of applause to the 18th Surgeon General of the United States, Dr. Bastien. And with many of you supporting her, she issued a call to action on breastfeeding in the United States in 2011. It was one of the first things that I attended as the Deputy Surgeon General. And I remember sitting there with awe, thinking to myself, oh my God, this isn't counterterrorism anymore. Right? All these years I've been working that, and I thought, you know how glorious this is? I remember sitting in the first row, and deputies tend to be the behind-the-scenes people. So I was there at the event, sitting in the first row, but hit with awe and splendor of those who were in the room, the enthusiasm with this call to action, but also once again realizing the potential impact of a statement like this. We all know, when we talk about preventive measures, we're certainly all about prevention. How do we make our society better, stronger, and healthier? And we know that the health impacts of breastfeeding are wide-reaching. Right? Decreased risk of infection in the infant, to decrease in postpartum depression in the mother. It's a whole span of things in terms of how there's a duality of that health benefit. It's not unidirectional. Beyond the concept of having that mother hold the child, right? Beyond the concept of the act of suckling, beyond the concept of providing that natural nutrition, right? There's a physiological basis, there's a psychological basis, there's a warming tendency that goes on with this incredible act. We also know that it has ramifications in our society. Right? Breastfeeding can reduce costs. Right? We live in a society now of kind of talking about economic burdens. And I went from the touchy-feely aspect of all this to what? To kind of saying, you know, if we counted up the dollar figures, there's even another reason, right? Economists of the world unite. Because the concept is it costs less. Right? That's a great part of this. It saves money, employer medical expenses. The idea of less time taken off for sick leave time for mothers in the workplace. Right? There are so many aspects of this that we can put out a whole litany. You know the answers to all this. My job is to make sure that others know the answers to all this so that we push ahead. More productive workforce. Key feature of this. Better for the environment. Right? Let's get the green movement on board with this. Which is all of a sudden there's less packaging, there's less things to be developed. Guess what? It comes from the breast into the baby's mouth. No intermediaries along the way. And certainly being a quarter century as a Fed, no booing please. The federal government plays a key role in this. Not the only role, as we'll talk about shortly, in terms of how this really is groupthink and group advocacy. But certainly the public health issue, as presented from the federal viewpoint, is there to support breastfeeding as an important component of our nation's health. We certainly support recommendations by the American Academy of Pediatrics. Breastfeed for 6 months, right? Then move ahead for solids. Then continue breastfeeding at least for 12 months, if not longer. Right? This is good for everyone. Yeah, I'm still having a problem here. Okay, here we go. So let's talk a little bit about the call to action and what succeeded from it. Now, I'm not claiming that everything's peachy keen. You know, I'd be the last person to say that the call to action changed the world to such an extent that we have no problems, no barriers, no controversies. I'd love to say that. Right? And I'm not going to bring up the issues at this point. We can do it as Q's and A's, although I'm not even sure what I'm going to answer to you. But you know, when it comes to very difficult times, fiscally, this is inevitable, folks. Quarter century in public health. Many of you have served the public health in various capacities. You know that when money gets tough, unfortunately, public health is amongst the first entities to say, you know what, next year. We'll cover you next year. And oftentimes we are in a world that then ends up being reactive. Right? Not even talking about breastfeeding, let's talk about sexually transmitted diseases, right? All of a sudden we solve a problem, things are better, bigger and better, STD clinics shut down, and next thing you know is there's pickup, and everybody's now, oh my God, we gotta throw money at it again, right? Because we have a public health dilemma. I can't change that. I can't change the world of fiscal government decision making. I can try to influence it through my advocacy, through my speech. You perhaps, as the voters of America, have perhaps even a stronger way of dealing with that. So be an advocate at your local and state levels, and certainly play a role at the federal level. We need to hear from you, but we also need you to contact the people who make decisions about fiscal situations in this country. So the call to action came out, 20 specific action points. And when we look at the objective to support breastfeeding through community-based organizations, breastfeeding is a key component of one of these listed up here. I guess it never transitions, or it's transitioning on the screen here, but not. We got to this one, but I'm not. That's all right. You know, I always sometimes, I really get afraid of PowerPoint because, first of all, I don't like necessarily always using slides. It's not a good mode of doing this, but in this case, I wanted you to see some of these things. But my backup always is I always carry 2 socks in my pockets. So when the PowerPoint fails, I do hand puppets. Okay. So I think So anyhow, we look at varied programs, right? We talk about community-based organization. Breastfeeding is a core component of CDC's Enhanced State Chronic Disease Prevention Program. This supports maternity care, quality improvement, employer accommodations, and peer and professional support for breastfeeding. A key component of this concept that part of the call for action. In response to the call to action objective for national campaigns that promote breastfeeding, there's various federal and non-federal partners. And they've collaborated with DHHS, and specifically our Office on Women's Health, and the Women's Health Campaign, It's Only Natural, Mothers Love Mother's Milk, especially in southern states, which have the highest rates of disparity in breastfeeding initiation, exclusivity, and duration. We know a good part of this conference has dealt with the idea of disparities. This is part of the programs that exist out there to try to at least deal with that issue. This important campaign looks specifically at the unique needs of the African American women, where initiation rates among African Americans are rising, but they're still lagging behind national averages. important that we look at those vulnerable populations, those underserved populations, and message to them, get to that population. In 2010, 62% of African American babies were ever breastfed, compared to 77% of all babies in the U.S. So we're still lagging behind. Another component of the call to action, to meet the objective to ensure that maternity care practices support breastfeeding, the National Institute for Children's Health Quality, under a cooperative agreement with the CDC and with critical support from, yes, you, the U.S. Breastfeeding Committee, has been leading the Best Fed Beginnings program. This is evidence-based, such a key component of 21st century concepts, evidence-based practices around maternity care to remove those barriers. Barriers that deal with initiation and exclusivity in hospitals, specifically looking at 3 different regions across the country. The South and the Southeast as one region, the Mid-Atlantic and Midwest, and then the West. The percentage of newborns receiving any breastfeeding during their stay in these participating hospitals has increased. And in 2 of the 3 regions, the percentage of breastfed infants receiving formula supplementation in these same hospitals has decreased. So we're heading in the right direction, right? Up and down. Where's the woman from Fort Belvoir? Tell me what just happened in this past week.
Baby-friendly hospital initiative. Fort Belvoir.
Right, barely 7% of all U.S. hospitals are designated as baby-friendly right now. Fort Belvoir, welcome to the family. Indian Health Service has put a lot of effort into the baby-friendly hospital initiative, right, as a result of this commitment to the Surgeon General's call to action to accelerate implementation of the baby-friendly hospital initiative. Right, we still have disparities in that world. There's been a more than 20% increase in the number of states with at least one baby-friendly hospital. This is unprecedented. New mothers in all but 7 U.S. states have access to baby-friendly hospitals. We obviously have to penetrate the market, that we not have onesies. We need to have multiples through each and every state and each and every territory of the United States. The National Breastfeeding Research Consortium, the Federal Interagency Breastfeeding Work Group. Again, these are programs that we feel at least are related to components of the call to action. Resources are now available that hadn't been available before. Tools and resources that the feds have developed along with our partners to help the stakeholders support breastfeeding. CDC's Guide to Strategies to Support Breastfeeding Mothers and Babies. This was released last summer. Reviews evidence. Once again, evidence. We're into evidence-based medicine here. Evidence-based decision-making. Evidence-based public health. Look at the evidence of effectiveness of a variety of the policies and environmental change to support women who choose to breastfeed and to increase the number of women who make that choice. It also shares examples and resources to help public health professionals put these programs into place. Resources. In June, the Office of Women's Health launched a new initiative designed for employers. We know women go back to the workplace. We know that workplaces oftentimes are not breastfeeding friendly. We need to be able to alter that. We need to be able to have an impact on changing those workplaces. And particularly, this program looked at those individuals in hourly jobs or settings that are more difficult to express milk at work. Supporting nursing moms at work, Employer Solutions is the name of the program. It includes an online searchable resource with creative solutions from over 200 businesses across a variety of industries. This is supplemented with photos, videos, and additional resources for support, and I'll show you one of those videos shortly. The final aspect of new resources that are out there, HRSA, the Health Resources and Services Administration, has developed and disseminated a toolkit, business case for breastfeeding. Notice, once again, a business case model. So we use this to supplement all the other things we talked about earlier, the benefits to the infant, the benefits to the mother, the benefits to that bonding. but thrown in, and very important, I can't emphasize this enough, in the 21st century, business case papers, economic viability, cost, return on investment. This all fits. It fits. If any of those were outliers, we could say, oh my goodness, we're going to have to pick up, we're going to have to beef up the numbers. No. Everything with breastfeeding fits into the model that allows us to enter this 21st century mindset. We'd love to run that video clip specifically from the Office of the Women's Health, and this deals with the difficulties in hourly settings. The two that I've been sort of intrigued with include one that deals with farm workers, right? Oftentimes migrant farm workers in fields. The one we're going to show you is an hourly worker setup. So allow us to indulge for a few minutes in this video. And I'll get a sip of water. With the call to action on sunscreens last words,
Carl's Jr. shows that it's not hard to support nurses. The company offers a small storage area and rotating schedules so nursing women can easily express milk at work. The management and the employees' team approach respects and values nursing employees.
I have helped some of my employees by returning back to work from maternity leave and leave of absence by allowing them to pump breast milk.
My goal is for 1 year to breastfeed.
Numerous of them have came to me and asked me questions of how they would go about doing so pumping at work, and I just try to provide them a designated area where they feel safe and secure to be able to express their milk.
She's very supportive. She's actually excited that I am breastfeeding.
As an employer, I feel that it benefits the company or the employer to allow the mothers to pump breast milk because it uses less time and money having to hire and train new employees because you couldn't accommodate your existing employees to be able to support them in a positive manner. I think it also helps with allowing employees to pump breast milk because it sets a positive morale in the restaurant, and then you have happy, quality, productive employees working for you.
Just don't be afraid to ask if you can pump at work, during work, break times. There's a lot of people on the clock, so there's enough time where I can sit down and we have to take our breaks.
I feel very proud because I'm contributing to their life success, not only as them as my employee, but as their children, which is our future. And then it makes me proud too to know that they can feel comfortable coming to me and talking to me like that we can communicate and work together because they're supposed to be a team.
If I wasn't able to pump at work, I would volunteer to quit. I wouldn't want to because I love my job.
I think as a fast food industry, being very fast-paced, short, limited space areas, having 4 lactating mothers at one time being able to pump breast milk, that if we can do it as a company in fast food, that any company in any industry could be able to do it the same.
Organizations, facilities that are looking forward for the good of their employees and ultimately plays a role for the good of our nation's health. But also the scenario, being able to put out those real life stories and talk about the best practices that exist out there. To talk about that, although it sounds like a hassle initially, that this is all doable. And again, to the benefit of so many different aspects, right, of our society. We're going to lead in now from the call to action and examples of what's worked from the call to action to specifically talk about the National Prevention Strategy. National Prevention Strategy is a component that's embedded within the Office of the Surgeon General. This is a council that had been established within the Affordable Care Act that said that we really need to change our focus in this country. And the vision of this concept is of the strategy and of the council's work, along with an advisory committee that came with that, again, delineated in the Affordable Care Act. All this under the leadership of the Surgeon General is working together to improve the health and quality of life for individuals, families, and communities, with the idea that we move from a focus on sickness and disease to one based on prevention and wellness. And once again, it's a matter that we're in a world that the reality is we're always going to have sickness and disease, right? It's always going to be part of us. And yet what we really know is that so many of the chronic diseases we're dealing with are in essence preventable. If we had caught that, if we had done something, if we had changed things in a person's life early enough. Right? Let's talk about the rates of obesity in this country as an example. Right? You have that cute little pudgy little kid who becomes the overweight teen, who becomes the obese adult. If we looked at that and said, where was there an intervention capability? It may in fact start with breastfeeding, folks. Right? It may have been But once I get to that point, right, of a preventable pathway, I'm now dealing with what? With the repercussions of what could have been purely preventable. Obesity, increased cardiac diseases, increased strokes, increased hypertension. So we know we're affecting that system. Diabetes, rampant in this country. Yet if we had controlled it early on, wouldn't quite have that impact. Osteoarthritis. Right? That's what the few of the examples that say if we had intervened, if we had put that focus on prevention and wellness. Something simple that we're trying to reintroduce. I'll talk about this a little bit later in my closing statements. But the concept is, we need to be healthier. We need to put that focus on wellness. And certainly breastfeeding fits in very well into this. Right? We're talking about the goal of the prevention strategy is listed in the inner circles to increase the number of Americans who are healthy at every stage of life. That includes infancy. It starts at that level. It includes a geriatric population, our elderly population. It's being healthy at every stage of life. And I have to say that my definition of health, I just steal it from the World Health Organization, because that is the grandest definition of health. And I want you to contemplate this definition. Because in essence, when you think about what each one of you is doing on a daily basis, this is the bold and noble mission that we have taken on. And health, as defined by the World Health Organization, is the complete, emphasis on the word complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. When we're talking about health, folks, it's all about everything. Physical, mental, and social well-being. And certainly breastfeeding plays a key role in the 4 pillars of this, which is how are we going to influence this? We talk about healthy and safe community environments, clinical community preventive services, empowered people. Right? The concept is we as Americans, whether it comes to smoking, whether it comes to putting on sunscreen, or whether it comes to breastfeeding, we as Americans, it's innate maybe in the way we were raised, it's innate in our national spirit. It's the sense of, guess what? None of us like to be told what to do. We really don't. We really don't. Don't smoke. Put on sunscreen. Breastfeed. The concept of empowered people is that our obligation is to take that information, to share it, to make it understandable, so that ultimately a person chooses what is the obvious correct answer for themselves and for their families. That's empowering people. That's the only way we're going to if I provide the information. And it'll never be 100%. Right? We're going back to we're celebrating this year the 50th anniversary of Surgeon General Luther Terry's first report ever on smoking. 50 years ago was the first time we said that, this is bad for you. Prior to that, it was a whole different world. And yet, even 50 years later, what do we know? Right? We know that of all the smokers out there, 70% want to quit. Right? They have the information. And all I have to do is find a way to lead them down that correct pathway. But I still have 30% who we kind of define as the happy smokers. They know what's going on. This is empowerment, but 30% are still deciding, I'm not into this. In the world of breastfeeding, we need to empower people. Not everybody's going to buy in. Right? But in essence, that's part of our mission and part of the mission of the National Prevention Strategy. Elimination of health disparities is the 4th pillar. And again, a major discussion. We briefly touched upon that. But it's powerfully tied in with the empowered people concept. which is we do have underserved populations in this country. We do have vulnerable populations in this country. And gosh darn it, we have to spend a lot more effort to make sure that those populations are well covered, that they are ultimately empowered as well. Support for breastfeeding can fulfill requirements in every single one of these directions. The strategy that came out in June of 2011. The strategy includes specific recommendations related to breastfeeding, noting that breastfeeding is the best source of nutrition and immunological protection for infants and protects the health of mothers. Federal departments. The council is made up of 20 different federal departments. Not because we're better, it's the sense is that we are there to discuss our community, the federal community. What can we do to instill this concept of a focus on prevention and wellness for that community? So within that federal family, we've seen various departments breaking out already. The Department of Defense will implement initiatives in its medical facilities that encourage military beneficiaries to breastfeed infants through 6 months. That's a DoD part of the National Prevention Strategy. Department of Labor, another one of our partners, administering Section 7 of the Fair Labor Standards Act, ensures breastfeeding female employees of covered employers have reasonable break time and space to express milk for their nursing children for 1 year after the child's birth. These are inroads, right, into our world. Policies that are coming out of federal departments that are getting on board with this concept. The strategy also includes recommendations, as I mentioned, to eliminate health disparities amongst those groups of people who have systematically experienced greater obstacles on the basis of their racial or ethnic group, socioeconomic status, or other characteristics that historically are linked to discrimination or exclusion. All Americans need to have the opportunity to live long, healthy, independent, and productive lives. All Americans need to have the opportunity to make that empowered decision to breastfeed. And this is the important part of how we achieve these goals. This is specific to the National Prevention Strategy, but it really is specific to any public health goal that we have out there. Long gone are the days where we say, oh, the feds are here, the world is safe. You know, early on in my career, I think there was a boldness and a brashness to this. And whether we hide behind the fiscal constraints, oh, we can't afford very many things anymore, or whether we've actually taken a more practical approach, right? The infamous saying, or the famous saying of saying it takes a village to accomplish anything. This, folks, is your public health village. These are public health partners in prevention. Yes, the feds play a role, but so do the states, the tribes, the local and territorial governments. They're part of this family, too, of prevention. Businesses, employers, right? I need to be able to find more places like that who say, from a business perspective, we're making an important public health decision. The healthcare professional world, right? The healthcare systems that exist out there, the insurers, the clinician, education. How do we get to our kids early on to make those right choices? How do we get to young mothers early on to be counseled appropriately to say, this is doable, and it's good for you and good for the baby? The role of community and faith-based organizations. And ultimately it boils down to, in so many ways, to us as individuals. What are we doing as an individual for the good of our nation? What are we doing for breastfeeding support? What are we doing in terms of keeping ourselves healthy? What are we doing in terms of us being the role models for others? And how do we then embrace our families to be part of this? If my vision is a healthy and fit nation, it starts at that individual level. It starts with policies at the top, yes, but that's not going to percolate down. It really boils down to a committed people who realize that health is not an option. That health oftentimes is thought of as a disregarded natural resource in this country. Ladies and gentlemen, it is the most precious natural resource in our nation. We revolve around concepts concepts, even in government, right? It's all about the economy, stupid, was, the word out there. And I think to myself, with the economy, we're constantly monitoring, right? Here's the interest rates, here's what's going on, home buying, home selling, blah, blah, right? We're constantly modifying things. And then when there's a crisis, what does the government do? We step in and say, oh, the Federal Reserve Bank has a major decision to make, and they're going to raise this, raise that, because we're trying to manipulate things. Guess what? The economy goes nowhere unless we have a healthy population, right? Workers can't produce. People are not important assets to that society. I want to change that paradigm that it's not about the economy, it's about health, stupid. That's what it's about. The strategy recommends that community-based organizations implement culturally and linguistically appropriate social supports for breastfeeding, such as marketing campaigns and breastfeeding support groups. Right? That these community coalitions, such as those with whom you are involved, help empower those individuals to take an active role in their health and foster those effective public participations in health-related policies and programs. It's importance of cross-sector collaborations. I can't do it alone, you can't do it alone. Let's join up and try to do this together. So, as you can see, the call to action to support breastfeeding has catalyzed this movement to make it easier for mothers across the nation to breastfeed. So a few days ago, the 2014 breastfeeding report card, I'm sure probably was already covered here, was just released last Thursday in anticipation, undoubtedly, of this important meeting. Shows that we're making some progress. Okay? That's the good thing. Are we where we want to be? No. But we're making progress. The number of IBCLCs, professionals who specialize in clinical management, and of CLCs, right, nearly doubled from 2006 to 2013. Breastfeeding initiation rates are rising. In 2011, fully 79% of newborn infants started to breastfeed. Initiation. Additionally, the percentage of women who have successfully breastfed for 6 months have been rising at approximately 1% per year. Okay, is that a great return on our investment? If we had money in the bank, although most banks are actually giving you less than 1%. Yeah. But the reality is we want that to be higher. But it's heading in the right direction. In public health, I got to tell you, so how do you survive over a quarter century in this uniform? There's no place in public health for pessimism. There is none. It would drive you insane. You look at 1%, you say, not where we want to be. There's a realism. But we're headed in the right direction. We're slowly making those strides. That means that every year, 40,000 more mothers are able to breastfeed each year than in the previous year. Small steps in the right direction. The percent of employers with lactation rooms rose from 25% in 2008 to 34% in 2013. We're above the 1/3 goal, folks. 2/3 left. 2/3 left. It's like running a marathon, right? You're out there. It's starting to hurt, but I need you to focus on that mission, right? Let's go up from 1% a year to 2% per year, right? That doubles our rates. Let's start really tackling those employers where it remains an issue. But once again, realism, there's still a lot of work to be done. The report cards show that breastfeeding did not continue for as long as recommended. So we have an initiation, but it doesn't persist. Of infants born in 2011, only 49% were breastfed at 6 months and 27% at 12 months. This is a call to arms to figure out how we keep this going. The roles of all of us in this. I'll actually profile briefly, and Captain DiMartino, I want you to come front and center on stage. So Captain DiMartino is the Chief of Staff to the Office of Surgeon General. He's actually one of the few leaders in our positions who don't have the title acting in front of him, so his job is for real. Captain DiMartino is also a career officer in the U.S. Public Health Service, in the Medical Corps, the medical officer in that famed organization. And I want him to spend a minute or two sharing his experiences with supporting his wife in breastfeeding.
I started here 2 years ago with Wozniak, and when I first saw that the Surgeon General put out a call to action on breastfeeding, I thought, that is great. How did that happen? I've been ever since trying to get in on his gig with this organization and trying to play a role there. I think in part because I learned very, very early about how difficult it was to make it work. And I have three now. I have a 9-year-old, I have a 6-year-old, I have a 2-year-old. And the first one, anyone knows, is the hardest. I mean, for a lot of reasons. And we realized that there are so many people who don't understand the importance of it. And God bless my mom, she didn't really get it either. And she wanted to be supportive, but I think she had lingering guilt from, 50 years of worrying whether, because she didn't breastfeed her kids, they somehow lost some IQ points. And so what happened is that you have family around, and if they're not supportive, it became so easy to just say, this is what a hassle this is, it's not working, it hurts, it's been a week, and then people move on. And I've seen this so many times in friends and family. And I remember at the time, my wife was really determined. She said, how can we do this? As she was crying through the pain. And we found this wonderful lactation consultant at the Military Medical Center in Bethesda. And she just, she gives good advice, she gave great advice, but the reality was she just allowed us to take a day at a time until we got over the hump, right? And that's what we tell people and say, listen, just get over it. If you get over that hump, you are free for every other kid you have with no guilt. And we wouldn't have it any other way, because I think that as Wozniak mentioned, am I going too long?
Well, you're fine.
That as he mentioned, it's not really. It's about the nutrition, thank goodness, but it's about so much more. Yeah. There's so many intangibles. During those times when we're getting vaccinations, right? Our kid is the only one who cries for the fraction of a second it takes to go from the table to the breast, and then it's over. And falling to the ground, the bad scrapes. I mean, it was sort of like the magic pill. Where else do you find the magic pill? And I feel fortunate that she was really strong about it, because I can see how husbands sort of get caught in the middle. So if your wife is in pain, she doesn't know how to get past it, and what are you going to do as a husband? You're going to be supportive no matter what direction she thinks she wants to go. Thank goodness that in her mind she really wanted to do it. So when she started having doubts, I just reminded her, you told me that we should do this no matter what, that we had to do this. And so I was sort of, all right, she hit me a couple of times, but we really sort of moved forward. And as I said, after Lobby was done, we never looked back. And the only reason she stopped after a year and a half was so that we could try to get pregnant again. Other than that, I'm sure they'd still be breastfeeding.
I kind of gave him a heads up that maybe I'd call him up, but he is such an advocate, he and his wife, for breastfeeding. And you got to realize that he's embedded at the leadership level of the Office of the Surgeon General. So when I have an advocate who's sitting in an office next to mine, guess what? I never stop hearing. So in conclusion, I urge you to continue to work to advance policies and systems changes that will make it easier for women to breastfeed during certainly at least the first year of life. I encourage you to remind others to convey that public health stakeholders from multiple sectors and perspectives can promote health and prevent disease by supporting breastfeeding. I appreciate this opportunity to speak to you today. This varied group of individuals, I thank you for your leadership in advancing our nation's goal to support breastfeeding mothers and their families. And we're discussing out there how in so many ways, as I've been falling into this and learning each and every day of what it means to be the Surgeon General of the United States, I now sort of put in parentheses in small letters acting. Because when they gave us this job initially, after Dr. Benjamin left, they said, you're the career guys, but you're only around for a few days. There'll be someone else. Then days turned to weeks, and weeks turned to months, and July 17th, we commemorated the first year of the acting. And my question to you is that the role of acting has been minimized, right? I now no longer capitalize it. I no longer spell it out. I sign my name with small letter A, and then it says Surgeon General. I take this job seriously. And as we look at all the initiatives we're doing, right? I mean, breastfeeding is one of the initiatives, right? 2011 call to action. We continue on that pathway. We're not letting up. I have a lot of things we need to be working on. Right? And the whole idea of smoking tobacco use in this country, as I mentioned, 50 years later, 480,000 Americans die each and every year from smoking-related diseases. If I thought that we were fine, we used to have a 43% smoking rate, we're down to 18%, that's good enough. Guess what? That means 5.6 million kids. 1 out of every 13 children now alive under the age of 18, I'm writing them off. 1 of 13, you're dead, you're dead, you're dead for smoking-related diseases. Is that good enough? No. I will not stop until we have smoking rates of 0 in this country. It's important. We're going to be putting out initiatives of, to a large extent, trying to make things a little easier. Right? You heard that I'm a runner, I'm a biker, I do all these mountain climb, do all these things. That's for me. It doesn't show that everyone needs to be doing that. But what I need to do is I need to get people to walk again. Right? That's what I need. It's the idea of walking, walkable communities. The issue of nutrition in this country, right? The fact is we're not eating well. That's another major problem. So I package all this together. I'm going to introduce, and this hit me outside there, is that lately I've been advocating the concept. And it's kind of, you know, it's Leave It to Beaver sort of concept. There was an age, perhaps it was a fantasy age, when we were a different nation. And you can't deny the fact that we're in the 21st century with incredible progress that has been made. Incredible progress in these years, right? We're connected, we're on the internet, we're talking to each other. We can make things happen by typing things out. We can't deny the progress. We can't deny the positive aspects of where society has gone. But I think it's high time we acknowledge the negative aspects of where we've gotten to. And it's going back to that Leave It to Beaver age, right? With the concept of saying, let's go retro. Let's go retro in the things that we've learned through this progress, where frankly we've blown it. And initially I sort of put on the concept of retro saying, okay, we're going to start walking again, America. Let's start walking. Get out there for 30 minutes a day and walk. Walk to the store. It's not just walk. The car is a wonderful instrument, but it's not always necessary. Not good for our environment, not good for our health. Let's start walking again. Then the next retro concept. Let's start cooking again. It's going to be a key role in terms of how we're providing nutrition to ourselves and our families. And now this morning it hit me, right? What a natural setting to announce the third component of Go Retro. Let's start breastfeeding again. Because raise your right hands up, folks, right now. You are now deputized out of the public health team, out of the the Office of the Surgeon General to make this nation a better place. Breastfeeding as that first initial point of where we're telling people, you can do it. We're here to help. Thank you so much for your time.